A new court ruling has escalated the war between St. Elizabeth Healthcare and the Christ Hospital Health Network, and likely dooming plans for a $23 million ambulatory surgery center on the old Drawbridge Inn site in Fort Mitchell. Wednesday's decision by Judge Thomas Wingate of the Franklin County Circuit Court clouds the future of the 24,000-square-foot facility on the highly visible Interstate 71-75 corridor at Buttermilk Pike. Kentucky approved the project a year ago under the Commonwealth Certificate of Need law, which requires government approval for any new medical facility. 35 other states have such laws, but Ohio and Indiana do not. Christ Hospital officials have argued that St. Elizabeth, as Northern Kentucky's primary healthcare provider, operates as a monopoly and needs the competition in surgery services. St. Elizabeth officials have said their system spends more than $100 million a year on care for the indigent and Medicaid patients and is shouldering the heaviest burden of the opioid epidemic. They have said Christ Hospital is trying to lure away better insured patients by oversupplying the area with surgery space. St. Elizabeth officials have noted that Northern Kentucky has 9 outpatient surgery facilities, 6 of which are owned by St. Elizabeth. After the state's June 2017 approval of Christ Hospital's plan, St. Elizabeth went to court, arguing the state created a special loophole for Christ Hospital's plan and gave the Mount Auburn health system an unfair advantage for its Certificate of Need application. Saturday, St. Elizabeth's boss called himself pleased and humbled by Wingate's ruling. This ruling will allow us to continue to improve the lives of the people we serve and assure an equitable playing field, efficient use of resources, and the availability of quality care for all, said the statement from Garin Colvin, President and Chief Executive Officer. Mike Keating, President and CEO of the Christ Hospital, said the court decision means patients will not have their wishes for more health care options. His statement did not shed light on what happens next with the project. Today was a setback for the patients and for the residents of Northern Kentucky, he said. We will continue to explore how to bring more health care options to the residents of Northern Kentucky, notwithstanding the efforts of others to limit competition. Christ Hospital has a doctor's office in Fort Wright featuring a magnetic resonance imaging machine. The much more ambitious Fort Mitchell project at Buttermilk Pike was to include the ambulatory surgical center, an emergency department and a diagnostic center. The facility was also expected to anchor the Fort Mitchell Gateway project, developed by Brandy Corp of Northern Kentucky, to include a hotel, restaurants, retail businesses and apartments. The fate of that larger development remains unknown. Fort Mitchell residents had voiced support for the Christ Hospital facility, saying that since the 2008 merger with the St. Luke system, St. Elizabeth has become an 800-pound gorilla in the region, swatting away competition. The odyssey of the old Drawbridge Inn site began in 2015, when the administration of Democratic Gov. Steve Beshear modified the requirement to gain a Certificate of Need application for an ambulatory surgery center, adding a population requirement that appeared nowhere else in the state health plan. Christ Hospital filed its application for the Fort Mitchell project, even as the Kentucky Hospital Association objected to the modification as written specifically to cover the Christ Hospital proposal. In 2016, the incoming administration of Republican Gov. Matt Bevin repealed the modification. Christ Hospital's application proceeded, despite St. Elizabeth's opposition that the population requirement was created solely for Christ Hospital's benefit. St. Elizabeth sued, but the case was put on hold until the state acted by issuing its approval of the project. In his June 20 ruling, Wingate noted that Northern Kentucky already has 9 outpatient surgery facilities that are each less than 50% utilized, well under the 85% rule, required to show that there's a need for more services. This duplication and proliferation necessarily impairs the cost efficiency of the healthcare delivery system in the planning area. Wingate said. More, why St. E says Christ's $24 million NKY surgery center is unfair. More, St. Elizabeth to fight Christ Hospital in Fort Mitchell. More, round 2 soon in fight of St. Elizabeth v. Christ Hospital read or share this story. https://sin.ci/2key8h4w